Good afternoon, everyone, and happy December. Thank you for joining us and waiting with us. My name is Kim Bittner, and I'm with the ESRD National Coordinating Center. This is the ESRD NCC Patient Education Webinar event. The ESRD NCC webinar events are held in partnership with the Centers for Medicare and Medicaid Services. The calls feature patients and professional subject matter experts from across the country sharing how they or their organization are coping with situations related to COVID-19. Now, before we get started, I do want to let you know that this call is being recorded and will be posted to the NCC COVID webpage, usually within 3 business days, but many times we will have the recording up on the webpage well before 3 business days. So let's go ahead and take a look at the agenda for today's call. Here we go. Today we are pleased to have Patrick G. and Tina G. join us. For those of you who don't know Patrick and Tina, they are husband and wife, and they have a true partnership. They are both involved with their ESRD network, Quality Insights Renal Network 5, and the National Patient and Family Engagement Learning Action Network, which we will refer to as the NPFE LAN, which is a group of patients with end-stage renal disease and their caregivers who design and spread practical approaches that can be used to help other patients become engaged in their health and care to improve quality of life. And we're going to go ahead and introduce them in greater detail shortly. Our topic for today is exploring the immediate and long-term effects of COVID-19, and as always, we will have time for questions at the end of this discussion. So what is this call all about? You will hear tips to empower yourself to cope with COVID-19. We will share some real-world experiences that you can put to use. We have some resources for you to use and share with others. And this series of calls is available to you bi-monthly, offering a variety of topics. So before we start with this presentation, we want to share a couple resources with you. And if I can have the next slide, there we go. Tips to help you boost your physical and mental health during COVID-19 was developed by patients for patients and offers 10 practical tips for coping in this environment. We have entered the holiday season, and we are going to be celebrating it differently this season. It's important to monitor and preserve your emotional well-being, and while this resource speaks to COVID-19, it's very appropriate for this holiday season too. This resource offers practical tips, and they're from fellow patients who can relate. You can find this resource and others at www.kidneycovidinfocenter.com. I can have the next slide. It's also flu season. This resource highlights the importance of a flu vaccine. It's available as a flyer or a poster. And for those of you who like to share our materials, or if you are with a facility, there's a version that can be customized. And you can customize it with your flu clinic hours or facility-specific information. It's available in English and Spanish. You can visit www.esrdncc.org/flu and then click on Print Ready Materials. So let's go ahead and go to the next slide, and we will begin our presentation. And as Tina and Patrick present, and you have questions, please submit them using the chat feature through WebEx or the Q&A on the lower right of your screen. And when we get to the question and answer section of this presentation, we will share the questions that we've received with our speakers. And our goal is to answer as many questions as time allows. And at this time, and you're looking at him, I'd like to introduce you to Patrick G. Patrick is a kidney transplant recipient from North Chesterfield, Virginia. He received a kidney transplant in April of 2017. And since his diagnosis of ESRD, Patrick has become a patient healthcare activist and is committed toward better quality of life for those with chronic illness. He volunteers, as we stated earlier, with the Quality Insights Renal Network 5 and their Patient Advisory Committee, serves as a field ambassador for the American Association of Kidney Patients, and he's also a subject matter expert for the Kidney Community Emergency Response Program, as well as being a legacy subject matter expert with the NPFE LAN. And the next slide, I'd like to introduce Tina G. And Tina has a Bachelor of Science in Criminal Justice from Kaplan University and a Master of Science in Public Administration from Central Michigan University. Tina works for the United States Marshal Services as the Assistant Chief of Administration in Washington, D.C. When Tina is not working, she enjoys volunteering and ministering in her community, and she's a care partner to Patrick. And she's also a subject matter expert with the MPFE LAN. If we can have the next slide, Jerome. Both Tina and Patrick were diagnosed with COVID-19, and as Jerome stated earlier, they were diagnosed with COVID-19 at the same time. So they were patients and caregivers simultaneously. And they're joining us to talk about their experiences and the long-term impact and kind of where they are now. I'd like to welcome you both to the call and thank you for your time.
Thank you, Kim, for having us.
Thank you. So before we get started, Patrick, can you tell us a little about your kidney journey, when you were diagnosed with kidney disease, and how long we know how long you had your transplant because I kind of gave that away, but can you just kind of tell us a little bit about your experience as a kidney patient?
Sure. In April of 2013, I was diagnosed at stage 3B with chronic kidney disease. At that time, I was referred to a nephrologist. Because I was diagnosed so late, I ended up doing peritoneal dialysis. My first exchange was December the 1st, 2013. I stayed on peritoneal dialysis until I got my transplant April the 21st, 2017. And that's when my journey took a shift to the left. When I woke up from my transplant surgery, the kidney did not. So 5 days after my transplant, I was told that I had a blood clot in my neck, so I had to have a second surgery. Also at the same time, because my kidney was not functioning, I had to do 24 hours of dialysis every other day. So they told me I had a blood clot in my neck, so I had to have a surgery. 3 days after that surgery, I was told that I was bleeding internally, so I had to have another surgery. 17 days after that surgery, I had a fourth surgery where they created a laparoscopic peritoneum window for me to drain. So during this entire time, I stayed in the hospital for about 33 days after 4 surgeries, and I was released to a rehabilitation center for about 6 days. Then I was released home, and my kidney finally started working on the 47th day.
Thank you for that, Patrick. That really shares a lot with everyone as to what you went through to maintain your kidney, and I think that'll kind of come into play when we talk about what you went through with COVID-19. So I appreciate you sharing that. And Tina, you are Patrick's care partner, but when he received his transplant, you were his caregiver. And Patrick has frequently said that he could not have gotten through the transplant without you as his caregiver. You remained with him in the hospital the entire time, so that 6 weeks that he kind of just talked about there. Can you share with us a little bit about what it was like for you to be his caregiver when you received his transplant?
Yes. Thank you again for having me. I was mostly scared because I did not know what to expect, especially when they told us that the kidney did not wake up. So when we got that news, I was like, I don't know, what does that mean? Does that mean our stay is going to be extra long, or can we go home? But from that day forward, I started documenting everything that went down, from the time the nurses came in, the different nurses, the different doctors, every medication they were putting him on, every medication they were taking him off. I had journaled all of that. From the time we left the hospital to go to rehab, I journaled all of that time. I was more, as he wanted to say, because I used to be a certified nurse's aide back in the day, I was reliving my nursing days. But I was just scared. I didn't know what to do. I mean, he was on so much medication. And other than me knowing what the medications was and me relaying to him everything that the doctor had said or asked those questions that I thought needed answers that I didn't think he even had the capability of asking because he was in and out on medication so much. It was very hard, very, very hard. But I'm glad that I was able to be there with him because some people don't have anybody to be with them, not even a neighbor or a significant other. So it was a journey, but I'm glad I was there.
Thank you for sharing that with us, Tina. Patrick, you and Tina were both diagnosed with COVID-19 at the same time. Who was diagnosed first? And share with us what that experience was like.
Well, that's real interesting. Both Tina and I had both come in from out-of-town trips. And we also found out that a member of our church had tested positive. So every time I tried to get tested, I was turned away. I was told that I wasn't sick enough, even though both of us started displaying some of the mild symptoms, low-grade fever, low-grade cough, sniffles, stuff like that. But I was the one to get tested first. Tina was the one that was diagnosed with it because Tina ended up being hospitalized. I took her to the emergency room, and what was interesting, they kept her for about a couple of hours and said there was nothing wrong and sent her back home. Yep. And then 5 days later, I took her back to the same hospital, and all of a sudden she has pneumonia. So when she gets admitted into the hospital, they give her a Cobit test, and the next day she's positive. So when I found out that she was positive, I called my transplant center. And I took my test on the 20th. I believe Tina took hers on the 24th and got her results back before I did. I didn't get my results back until the 30th of March.
Mm-hmm. Yeah.
And Patrick, I don't mean to interrupt. This was back in the very big, kind of in the early stages when we were first learning about COVID. So this was it March?
March.
Yes, in
yes,
March.
Ma'am.
Okay. Yes, early in March. We thought, I thought I was cold. I didn't know. Symptoms of COVID, like you said, we were both coming in from different places. I had just came in from my job from Tennessee, and because of his kidney, when I travel, I already knew I had to have a mask on because I didn't want to bring home anything to him. So I'm doing my normal precautions to make sure I don't bring any unknown disease or cold home to him because he has no immune system. And I get home, and I'm sniffling and feeling bad, and I'm thinking, oh, man, it's just a cold. I don't know what's going on. But like you said, when he took me that second time and I was admitted, that was a journey within itself. Oh, my God, that was a journey. I wasn't even able to see him. They wouldn't let him in. They wouldn't even let him up to the floor that I was on. When I was told to, let me back up just a bit. When he took me to the hospital and I walked into the emergency room, they wouldn't even let me have a chair to sit down in. I told them I wasn't feeling good. I felt like I was about to pass out. And they were like, well, ma'am, this COVID ain't no joke. Can you just stand right there? Let me get your temperature. And I answered all the questions, the COVID questions. And she's like, yeah, you might have it. So then I'm thinking they're going to wheel me in to the hospital, and they didn't. I had to walk all the way from the emergency room entrance all the way back to the back side of the hospital. Walk, not wheelchairs, walk, barely breathing, hard to breathe, taking my time. And the nurse in front of me was like, it was like they didn't care. And it might have been because they were scared. I don't know. But the treatment I got, that was not the right treatment.
Definitely different environment. And Patrick, you had talked about once you learned that Tina had been diagnosed, you called your transplant center right away. What were some of your initial concerns, obviously when Tina was diagnosed, but also when you were diagnosed?
Well, because being a kidney patient, I just knew I would be able to get tested. But again, it took me 4 times to get tested because I wasn't sick enough. So when I called my transplant center and told them that Tina had been admitted to the hospital and she tested positive, it was at that time that they administered a medication called hydroxychloroquine, which at that particular time they used on kidney transplant recipients in Seattle, Washington, as well as New York. It was really the only go-to medication at that particular time. So because at the time my symptoms were mild, they figured, and plus I hadn't gotten my COVID test back yet, so they figured that if I took this medication, I could get ahead of it, and it would just kind of wean itself off. So in the back of my mind, I figured I was positive, but hopefully this medication would work. So really by the time Tina got out the hospital, I got my results back, and that's when I tested positive. So we basically had to self-quarantine in the house, where I slept downstairs on the couch and Tina was in the bedroom, because I didn't want to reinfect her, especially because, she was like a banana peel away from being ventilated in the hospital. And then, of course, the side effects of the medication that I was on led to my mild symptoms becoming more moderate to severe, to where I had to be hospitalized overnight to have a series of tests done to make sure that my kidney function was well. And, because I'm diabetic, all the risk factors that made me vulnerable to COVID were addressed at that particular time.
So as you both were recovering at home, how did you manage this? Did you have any support?
No support. It was day by day. Who had the most strength? Like he said, he was downstairs and I was upstairs. So he was able, there was a bathroom and everything downstairs, but as far as helping one another, it was day by day. We talked, via phone, hey, how you feeling? You think you could do this, or you think you could do that? And we just kind of rotated back and forth because we didn't have any support.
Basically, it was a coin flip. Whoever had the most energy when they woke up was the care partner or the caregiver.
Mm-hmm.
Which basically meant it was the blind leading the blind.
Yeah. Every other day.
No. And did I hear you say that you were using your phones to communicate?
Yes, because he was downstairs and I was upstairs. And since we were quarantining, that's the only way we could. And I could have screamed, it wouldn't have made a difference. But it was easier to use the phone, trust me.
Yeah, it was the same way when Tina was hospitalized. We just FaceTime and text and stuff like that, since I wasn't able to visit.
Couldn't come on the floor. or anything. No one was allowed to come and see me. I was in a room that didn't get cleaned properly. I didn't get any clean clothes. I was in the hospital 3 days before they even offered me a bath or even changed my sheets. I really think it was because COVID was so new. Nobody wanted to be at risk. But I know in my mind and minds there had to be a better way. There had to be. Here I am on oxygen, and nobody's coming in my room. Everybody's, the nurses came in with their gear on, but that was only to give me my medication. But as far as communication or anything, like he's saying, we had to talk through the phones on the video.
Well, you definitely found a way to use technology, so that's a benefit that we...
What were we going to do if there was none? Who was I going to
right.
tell? Hey, tell my husband that this and this is going on. I felt lonely.
Exactly.
He is my care partner when I am sick, and I am his care partner when he is sick. So I didn't have that backup plan. I was worried. I was like, what if I forget to ask a question? What is all this medication? I was in and out. I was like, oh, my goodness. I had nobody for backup. That was my biggest fear. Nobody would know what actually went on because nobody was there with me.
So speaking of technology, kind of transitions really well into telemedicine. And as you were recovering, were you able to use telemedicine to speak with your healthcare team? And Patrick, do you continue to use telemedicine for any of your appointments now?
When it came to my aftercare, my team has to be the greatest team in the world, and I'm not just boasting about that. Compared to how Tina, even to this current day, it's like when she got released from the hospital, that was it.
Yeah.
There was no follow-up or nothing. But for me, I stayed either on a telecall, FaceTime, or text messaging with all of my physicians, my nutritionalists, my transplant team, my primary care on a daily basis, sometimes multiple times during the day.
I didn't get that. I basically had to call my doctor and say, hey, did you know? And this is what's going on, and this is what I was told, and what do you think about that? And can I go be retested to see if I have the antibodies? Should I be retested to have the antibodies? He's right. I'm just telling you, his team was on it. I didn't have a team. And I felt some kind of way about that, but I don't know. I just wish I could have connected with his team as well as I did not connect with my one doctor.
Yeah, it was really interesting because even with the adverse effects of the medication they put me on, my team, they was extremely apologetic, and I wasn't mad because, again, even research has showed this was the only medication that was out at the time, and it could have caused fatal mortality incident. But thank God that didn't happen. But, the treatment, even right now, tested and I had the antibiotics. They put me on their COVID registry. And even though I'm still dealing with lingering side effects from COVID, as well as the side effects of the medication, they give me a choice now. Some of my appointments are telehealth, others where I need to go and, do labs. I'm able just to go in and do labs, and then that's it. So, they keep me very protected, updated. I'm more than well taken care of by my team.
And me, on the other hand, I've been
good.
on the phone with mine, and I have yet to have a full physical with any of my doctors to say, okay, well, Tina, you look like you're recovering, any side effects or anything. It's just by phone.
Well, I want to kind of just change direction just a little bit. When we started the call, we mentioned that we've entered the holidays, and I'm kind of curious, how has this experience changed your holiday plans? I know that you have a lot of grandchildren, and are you able to spend time with them? Have you had to explain to them about, what is COVID-19 and, why you might be limiting any of your visits with them?
Well, this is why FaceTime is really good.
Yes.
The kids, our grandkids don't understand kidney disease, even though there's not a lot of education out there. They're not really teaching this in health education in high school or anything like that. So it's a hard concept for them to understand. But we keep in time by way of FaceTime and stuff like that. And my son and his wife just got over COVID last week. So our holidays are very quiet. We don't have no ill feelings because we still.
No, we don't. No, we don't.
Yeah, so everybody kind of understands, and if they don't understand, they will understand. But
we're trying to keep everybody alive.
Yeah. So it's not personal, but I just need to live to see another day.
So, Tina, in the beginning, you talked about what your experience was like as the primary caregiver to Patrick when he received his transplant. And I know this was different because, at one point you were a patient, another point you were the caregiver when you were both diagnosed. But did you use any of your experience from the transplant caregiver experience as you progressed day by day? Were there any new lessons that you learned?
It was a new lesson every day.
COVID?
It was a new lesson every day.
From a caregiver perspective.
Yes, it was a new lesson every day. I think this COVID thing versus being a kidney transplant patient. I knew I had a better understanding of the kidney transplant. I could read about it. I could research about it. I knew some of the things that I could do as a caregiver for myself and some of the things I needed to do as a care partner for him. With this COVID thing, it was kind of hard using those skills because it wasn't that easy. Either we had to quarantine from each other or we didn't. The stress levels were much more higher, and I want to say that had to do a lot with the COVID. I mean, there were days where, I ain't going to say I was out of my mind, but I didn't want to be bothered. And he didn't want to be bothered. When I was a caregiver for a kidney patient, I knew what to do. I mean, I knew the steps to take or the path to take. But with COVID, taking those paths as a kidney person, they didn't work out all the time. Didn't work out at all. So, every day was a new learning day. I would say the only thing that stayed the same or was the same was the communication. I just learned to ask, hey, are you okay? How are you feeling today? Not assuming, because there was no research or nothing to fall back on or to Google, as they say. I would just ask, is there anything I can do for you? Are you in pain? I noticed you were coughing a lot. Do you want me to get you anything, some tea or something like that? Sometimes when he was coughing and I didn't ask those questions, I thought I wasn't a good care partner. I was like, okay, so he didn't say nothing, so what does that mean? Communication.
Good. That's good advice there, Tina. So we are now about 8 months post your diagnosis. How are you both feeling after that initial COVID-19 diagnosis?
Whew. I still have my days. Some days I'm more tired than others, and they said that's the COVID something. But I don't know if that's really COVID or is that just the side effects of everything that's gone on. We've been quarantined for a long time, and this is my first time in my life I've had to be quarantined for anything for long periods of time. So I'm tired some days. Some days I'm irritable. Some days I can't sleep.
Yeah, Kim, for me, my physician told me that I was dealing with post-infection fatigue syndrome. So with that being said, there are days where I'm feeling all right, where I have a lot of energy and I can move around. And then there are other days where I just can't move, period. It takes me longer to get up out of the bed. Sometimes I have brain fog, still have joint pain. I feel lethargic at times, still have sleepless nights. And they told me, because COVID was so novel, like earlier when people started having these symptoms, physicians kind of blew it off because it wasn't the norm when it came to COVID. But then they had to realize, everybody doesn't experience COVID the same way, and they kept noticing different things popping up, such as, with people having acute kidney injuries and stuff like that. So when my care team started noticing all these different things, again, I had to go to a neurologist, had to do a number of tests, and this is why my team really keeps in contact with me, because really the only thing that they can do is to monitor it, because new things keep popping up every day until they can really get a handle on it. So for me, it is getting better, but, there are still good days and bad days post-COVID.
Thank you. Thank you for sharing that with us, both of you. How would you say this experience has impacted your emotional well-being?
Well, Kim, I'm going to tell you like this.
I still want to smack him, Kim. It ain't going to change that. Because I don't know if that's COVID or if that's a kidney acting out. So,
I'm going to tell you this. With COVID, they really don't talk about the mental duress, especially, with folks living with chronic kidney disease or any type of chronic disease. You already have a certain level of anxiety, of sadness, maybe slight depression, stuff like that. But then compound that with COVID, it's another level. Especially when you are dealing with people that don't want to wear a face mask, when you can't get physicians to understand your emotions. I know for me, being an ordained minister, my faith was really tested. Here I have my wife who stuck by my side for 6 weeks while I was in the hospital, and I couldn't go to the hospital. And then, finding out how Tina was treated, I was really in my feelings. I was pissed off, and every time I'm looking at my wife, it's emotional. I mean, there were times where Tina couldn't even hold the phone. So she's FaceTiming, and all I see is the ceiling. But I can hear her voice, so I was feeling good. So it was rough.
It was rough.
I mean,
It's a journey.
it was rough, and trying to explain to people became a challenge because, you know, whether it was some sort of advocacy or folks wanting you to write articles or stuff like that, people just couldn't understand that, hey, I need to take a break. I'm not able to function right. I'm not able to concentrate. And, you know, with me, the people in the kidney community that were dying is what really was my demise. There was a situation where, you know, being a member of the K-PAC, we lost valuable and good friends that that we last saw at the CMS conference. And next thing you know, folks are dying left and right. And even to the point, a good friend of mine that I dialyzed with, I'm on the phone praying for him, and he dies in the midst of me praying for him. So that took a toll in itself. Still trying to minister to people and pray for them. And at the same time, I can't find any comfort. I can barely pray for my wife. So it was really troublesome. And I just thank God that we were able to really get over it. But, you know, during this time, I just really hope that people can understand that you really need to call on a higher being during these times. And just for those folks that are loved ones, there's no need to hate anybody during this time because, you know, with COVID and with the numbers continually to increase, tomorrow isn't promised to anybody. And that's facts. So there were some good things that came out of that, but that was probably one of the most hurtful things that came out for us was just the emotional duress of having to deal with it. I mean, I would hear Tina cough downstairs, and it was almost like I had to make a hazmat suit just to come up in here in the bedroom to sit in the bedroom. Then people would FaceTime us, and, you know, they're seeing us sitting there with a mask, and, you know, they think it's a joke. And they fail to realize that we're like a banana peel away from dying. And, you know, so it was just things like that. But I just thank God for, you know, for us being able to make it through, and other families that were able to weather this particular storm.
You shared a lot of real feelings there, and I'm sure there's a lot of people that can probably relate to some of those emotions as we continue to kind of go through this journey in this environment. So thank you, Patrick, for being open with and honest with some of those emotions with us on this call today. I know that you both are active in your community with your volunteer activities. Has this impacted your community involvement in any way?
Yeah, because you can't, for me, I don't know where anybody's been. I could be wearing a mask, and even if they wore a mask too, that doesn't make me feel any more comfort. Sanitizing doesn't make me, I feel like I should have been, like they've been advertising here for all these movie stars, I should have just been in a bubble. I would have felt more comfortable. But we haven't been able to go out and do our community involvement like we used to, because we just don't know. We just can't take that chance.
Well, that's on Tina. My work has increased. Somebody dubbed me the poster child for chronic kidney disease and Cobit. So I have been strapped down to WebEx, Zoom, Skype, everything. Because of COVID and kidney disease, I've actually had the opportunity to be on the guideline development group for the World Health Organization since May of this year, working on a lot of the therapeutics for COVID because I had tested positive and because I was on one of the medications. So it has really given me some insight and really educated me on the different types of therapies that are coming out. So I guess that was probably the biggest blessing out of this whole thing, to be able to represent the kidney community, you know, on an international level. But no, not being able to be boots on the ground, COVID has really hindered that. But
yeah.
But like I said, social media and everything else is really taking its place. So I'm still able to talk to dialysis patients by way of FaceTime or email, text, phone call, but just not as much in person as as we have been used to doing.
Okay. And for our last question, we'd like to ask you both, what advice or words of support would you give to patients and caregivers who have been diagnosed with COVID-19?
I would say journal everything. Write it all down. There is nothing too small or too big because COVID changes. They say daily. I want to say hourly. That anything could happen, especially if you can't see your family. Write it all down. Write it all down. Be patient with your family if they are going through COVID. Don't expect the world from them because it affects everybody differently. I would say communicate. Don't assume you know your significant other or your family member like you thought you did. When COVID hits, it's a whole different animal.
Yeah, for me, Kim, I would say, you really need to smell your flowers while you're living. The voices have increased. People who have fallen onto dialysis or kidney disease, they've been abandoned by loved ones, by family members, just because they have been afflicted with kidney disease. And it's a really test to see of the word love. You know, people will say they love you until the leather hits the road, and then, all of a sudden, love goes out the window. So I would just tell folks, whatever ought or disagreement you have with somebody during this particular time, that needs to go out the window. And you need to focus on the humane part of living life to the fullest. Be kind to people. Take care of yourselves. Make sure that you make all the provisions that you can as far as, having a list of, your care team contacts, your medications, because there's still, like with transplant recipients, tachylimas, there's still a shortage with that, even in the midst of COVID. And this shortage was supposed to be over May of this year, and it's still continuing. And just be mindful that you really, really, really need to take care of yourself. And the best way to do it is to stop watching TV. Make sure that, for the folks that's listening, they need a reliable source of information. So for COVID information, they need to contact the NCC. They need to contact the ESRD network. Even working with the World Health Organization, they don't always get it right. Even the CDC fumbled in the beginning when they said that everybody shouldn't wear a mask. And for those that are recipients of a kidney transplant, we always travel with a mask, regardless of what the CDC said. So you know your body. Take every precaution to hand wash, wear a mask, and if you are going in large areas, you may want to rethink that, because here again, now we're finding out that people are being reinfected. So,
thank you both very much for your time today and sharing your experience with us and your insight. You gave a lot of helpful information, and Patrick, I really liked your insight about just to care for other people. That's been very insightful and helpful. So again, thank you for your time today. And now we want to hear your questions. It's that time of our presentation. And if you haven't already done so, submit any questions that you might have for our panelists using either the chat feature or the Q&A through the WebEx. So we have a few minutes so we can take a couple questions. And it looks like we have one that just came in. And Patrick, this is perfect for what you had just mentioned. Are either of you concerned about reinfection?
I am. In my job, I travel at least 6 months out of the year. I'm always on an airplane. I'm always going into a facility. I'm always around people. That is my biggest concern. There is nothing more concerning to me than to know, can I be reinfected? There's no one out there talking about that right now. They're all worried about getting this vaccine. But is that vaccine going to stop me from being reinfected? That's my biggest concern.
Yeah. For me, we limit where we go. We try not to go into any large crowds. Just like I told you, my son and his wife and family are just recovering from COVID, so I know we're not going to see them anytime soon, and they are aware of that. So, yeah, we are very concerned about that and taking every precaution we can to prevent any type of reinfection.
Okay, thank you. And Patrick, this looks like this actually it'd be good for both of you. But Patrick, before your COVID-19 diagnosis and with having a transplant, were you aware of the risks of contracting COVID-19?
Yes. Yes, I knew that I was at risk because of diabetes and hypertension and also having a compromised immune system. So, yes, I was. And I thought, in my mind, I was taking precautions, wash my hands, wearing a mask every time I traveled. But again, I couldn't even tell you how I got infected. We were contacted by the health department, of course, once we were positive, but we never heard from a contact tracer. So I don't know if it was from the person that was at our church that I was in contact with or not. So I'm not sure. But, yeah, I was very aware. And in the beginning, there really wasn't any information out for kidney patients. That was one of the biggest things. We really didn't know what to do. Even when I was traveling, I asked my transplant team if I could travel. I was going to Washington, D.C. To do kidney education, and they was like, fine, go ahead. And I stayed up in D.C. for a day. So as I'm coming back, I get a call from my transplant team, and they was like, hey, things have changed in 24 hours, and as soon as you get back, we want you to quarantine for 4 weeks. And this is without even getting tested. They just wanted me to quarantine for 4 weeks just as a precautionary measure. So basically we was just going based off the information that we had at hand. But now that I know, taking even more precautions.
For me, I knew I could have a chance because I suffer with asthma. But just like Patrick was saying, we took all the precautions. We thought we were taking all the precautions anyway because we were already being safe about him not having an immune system to begin with. So, we thought we were doing everything right because of the kidney, not even considering COVID.
Right. And like you had mentioned in the beginning, you were diagnosed when COVID, we were just beginning to learn about COVID. And so we've learned so much more during these past months, and we continue to learn.
Correct. So I was beginning.
Thank you. So thank you again, both of you, for everything that you have shared with us. And we'll go ahead and wrap this up. Here we go. And as you know, we've been discussing COVID-19 during this call, so we just want to remind you to visit kidneycovidinfocenter.com to view up-to-date COVID-19 patient resources. As Patrick had mentioned, this is one resource that you can go to get a lot of useful resources. And when you visit, click on the For Patients button to gain access to a variety of resources. Next slide. We also talked about the impact that COVID-19 has on families. When multi-generations of family live together, special considerations are needed. So this resource looks at the common needs of family members living together and offers tips for coping with COVID-19. It's available in English and Spanish, and again is available at that website of kidneycovidinfocenter.org, and then click on the For Patients. Next slide. Telemedicine was discussed, and Kidney Patient Care, your guide to using telemedicine, is a toolkit that explains telemedicine, offers tips to enhance any appointment that you may have, includes a checklist, and an appointment tracker. So go ahead and check that one out too while you are at kidneycovidinfocenter.com. And then for our final resource, we want to remind everyone about the Kidneyhub.org. Is a mobile-friendly web app developed by NCC with lots of input from our patient subject matter experts like Patrick and Tina, and has information on home dialysis, kidney transplant process, infection prevention, mental health, emotional well-being, and more. So go ahead and take a look at it. You'll want to save it on your smart device, and then you'll have easy access to all of the resources that we have featured on it. And as a reminder, our patient COVID-19 webinars have moved, are bi-monthly. And so the next one, the next provider-focused event is December 9th at 3 p.m. Eastern Time. And the next patient-focused event is December 15th. And then you can find those again at that great website, kidneycovidinfocenter.com, for more information and to register for all the events. We want to thank you again for joining us today, and for additional resources, be sure to visit the CASER website at casercoalition.com. Thank you, everyone, and please have a good afternoon or evening, depending on your time zone. Take care.